Expecting mothers will now have an improved experience when delivering their babies at the Karl Heusner Memorial Hospital. That is because today a newly refurbished labor and delivery unit was officially opened to the public. It is a milestone for the National Referral Hospital and very much needed. While the bed capacity remains at 7 for the transient unit, the improvements are primarily for technical operations and the response to emergencies.
We actually was able to successfully complete the specs in terms of the floor plan, the layout, the renovations, about maybe 7 months ago. And we were looking for the funding to support the project, given what we had just recently gone through with the structural repairs that we had. The Minister of Health was here at the time, and he committed to supporting a portion of it. So the total project cost just over $140,000, of which 50% of that total was supported through the Minister of Health.
And we saw all the inconvenience that patients had before. So when CEO came in, we spoke about it, and she did the walkthrough also with me, and we realized that, you know what, this is very essential. I have said it before, and I will say it again. We need to repair our facilities.
And so, some 2 years later, and having invested over $140,000, the labor and delivery unit has been retrofitted to provide better service to the public, with a waiting area, properly installed gas lines, and ready-to-go staff. CEO Michelle Hoare says that the amenities will allow for obstetricians and gynecologists, as well as properly trained midwives, to provide top-notch services to pregnant women during their delivery, whether naturally or by C-section.
About 50% of that went to the upgrade of medical gases, which actually was done in 3 of the main areas of this delivery, labor and delivery area, The labor room, which is just across the room from here, we've upgraded medical gases. So there's a 3-bed capacity in that room, and in each of those beds there is medical gas support. And the reason for that is in case there is any emergency, patients, running into crisis may need monitoring, oxygen, intubation, those type of critical care emergencies. The medical gas support allows for that. In both of the delivery rooms, this being one of the 2 delivery rooms, there is also the medical gas support in this room, as you see right here on the wall, and it's on the other side as well. And in our post-delivery room, there is a capacity for 4 beds, and in all 4 beds, there is medical gas support. So that was the bulk of the cost for this project.
Minister of Health Pablo Marin says that going forward, the mission is to rehabilitate existing health facilities.
We need to repair our facilities. It is hard for me now to start to do new ones in different locations, because to get the staff, it's very hard for us at the moment. But for us to renovate, and what you're seeing now is renovation, that is what we're going to do, and we'll concentrate on it. I want to also say that I think by September, October, we're supposed to start through SIF, the hospital, the polyclinic in Belmopan. That is one of them that is really needed, and that is the way we're going to move forward.
So the intention is to improve all the medical facilities countrywide, one by one?
Yes, definitely, and that is what you're going to see. Right now we have two main projects, one with the EU and the other one, it's still with PAHO, is for us to try to do smart hospitals, and that is where we're going to start to improve all the facilities.
Duane, Moody for News 5.